In respect of everyone's time, we're just going to jump in and get going. So Elizabeth, if you want to flip to the next slide. So thank you all again. My name, for those, I know we have a lot of new faces. So for those who don't know me, my name is John Chapman. I'm the Acting Executive Director for North Central Accountable Community of Health. And I've been in this role since January 1 of this year. You'll see other NCACH staff members on this call as well as other partners. I know a few of you have been part of our partner convenings in January and February, and just welcome you guys back to continue on the discussion and welcome those new faces. We're really utilizing these partner convenings as a way to bring the broader region together to think about how we move NCACH's mission and vision forward and how we as a region move together to improve health and well-being of our residents. So you'll see different topics throughout the year, and at the end of this meeting, we will also pop in a registration link for the next partner convening. So I encourage you guys to keep joining and keep being part of this conversation. This is really a regional and a community focus and initiative, and so we can't do it without the help of all of our partners. Today, we're going to have, especially in that topic today, we're going to have a presentation from Visual Networks Lab, who NCACH is working with to do regional network mapping analysis, and you'll hear more detail about that from the team and from Visual Networks later on. We're going to have a few open and small group discussions, and then again, closing the next steps. If you go to the next slide. As we get into today, we always want to start and focus on some just general working agreements about the discussion. So again, honoring, trying to start and stop on time. If you're an individual who chats a lot, encouraging others to speak up and sharing that airtime. If you're an individual who tends to be a little more quiet, again, encouraging you to speak up and share your ideas. This is an area where we can test new ideas and take risks. So, you know, sometimes when you are nervous about sharing an idea, I encourage you to share it. A lot of the things that are innovative and creative come from discussions like this, and probably some of the things that could have been wonderful get missed because people are just scared about sharing an idea that they don't think is correct or right. There's, you know, again, this is a place to be creative, share ideas, challenge ideas, and really learn through dialogue. And that goes on to the next slide. And one thing that we're really pushing and promoting is the spirit of dialogue. So I'm not going to read through these two different tables, but really when we're discussing today, we want to be in a space of dialogue. So there's two different ways you can engage in discussions. One is really around debate and one is around dialogue. And so we really read through those different roles and think about where you think we can be at in this discussion. It's not really about winning, it's about exploring common ground. And it's not defending assumptions as truth, but reviewing and evaluating assumptions. So, you know, again, this is a space to learn and grow. And I would expect that we all have different ideas and all different thought processes. If we all thought the same way, it would be a boring world. And so I encourage you all to challenge and push through dialogue some of that thought process. If you want to go to the next slide. One thing as everyone is logging in before I jump into this, if you can put your name and your organization in the chat, please continue to do so. And thank you all who are joining today. Also, if you can share your camera, turn on your camera. I really encourage you again to turn on your camera so that we can see your face and put a name with a face. In this digital age, you know, these are sometimes the only connections we're able to make, and I really encourage that. So we've shared this a little bit, a few meetings, so this will be similar to what some people have seen and new to others. So NCACH really has been focusing on changing and driving the mission and vision. Back slide. of our organization, and 2022 is really a bridge year to move us from our original mission that we adopted 5 years ago when we were really focused on the state's Medicaid transformation project to one we really have worked on to define as the value of our region. So, in the past, many of you have probably thought of us as a project management, clinical healthcare improvement organization, working with clinical and community partners to improve the quality of care, the cost of care, and quality outcomes for residents. And that was a large driving force for a number of years for us. But again, in 2020, we actually adopted our mission statement to our new mission statement, really focused on advancing whole person health and health equity. And so really looking at the whole picture of health that impacts an individual. And instead of really focusing on projects and project management, we're doing it by bringing the partners together to support collaboration and drive change. So you'll hear us speak throughout a number of meetings that we are really here to bring the region together to achieve, health improvement. We are not the organization that does it, but we're just a supporting force for everyone on this call to improve health and health improvement. If you go to the next slide, I'm going to turn it over to Caroline.
Thanks, John, and good morning, everybody. For those of you that I don't know, my name is Caroline, and I've been working at the ACH for close to 4 years now. And many of you have seen this slide. If it's new to you today, just know that these 3 pillars or principles were adopted by our board last year, and they're designed to really shape how we work together in the future. So we've worked on the Medicaid transformation in the past, and now we're kind of envisioning what we want to accomplish as a region that we kind of decide on our own. And if you've looked at this slide, or if you're looking at this slide silently wondering, what the heck does this really mean? And what should I expect from all of this? Then you're not alone. And to be honest, we have wondered that ourselves as staff, and our board is grappling with this. And we are going to keep making sense of it. But we're going to share a little bit of what we think, how we interpret these 3 pillars on the next slide, a different way of looking at the 3 pillars. So perfect. Thanks, Elizabeth. So we have the same 3 pillars here, but you'll see we're showing them in a different way. And the point is that as we've been talking about these 3 principles, we realize they're very interconnected, and they're kind of nested within one another. And it's not like you do one and then you're done and you move on to the next pillar and you accomplish that, you're done, you move on to the third. It's like you're constantly working on these 3 things. But like I said, you might be wondering, well, I don't really get what these 3 things are about. So it's going to be a little bit of a text heavy slide, mostly because we wanted you to have it as a handout as well. But I'm going to share some of what we're thinking about what these mean and what to expect. So can you click, Elizabeth? So building through an inclusive process of distributed leadership. That's kind of a mouthful. But what we mean by that is that we're really working right now on inviting participation and expanding relationships with partners. And one of the ways we're doing that is today's convening. And we also have webinars, and we're also going to join other people's meetings that they hold so that we can keep building relationships. And we're also spending some time learning together and evolving our mindsets and exploring questions like, what does it take to create conditions that all people need to thrive? Like, what do we even mean by conditions? What does it mean to share power and work in a distributed way? And what does our network look like? What does it tell us about how we should work together on this really like complex, complicated health and well-being? Like there's a lot that can be done in that space, and it's so complex that it can get overwhelming. So once we've kind of built relationships, and we're going to keep doing it, it's a continuous process, we also need to look at data, and that's what the anchoring and shared measurement pillar is about. So can you click, Elizabeth? Perfect. So this is about understanding your data needs. What data do you have access to, and what do you not have access to? And what does that mean in terms of blind spots that you might have? And then it's working with partners, including public health partners, to bring data sources that exist together in a way that's more like helpful and meaningful, or even collecting our own sources of data. And when I say data, I'm really talking about data that can help us understand who's healthy and who's well in our region and who's not, and what can we do about it. And then once we collect data, we want to make sure that everyone has access to it, right? It's not about someone guarding the data and using it just for themselves. It's sharing it with everyone so you can all do the great work that you're doing. And then also trying to come up with meaningful indicators that can tell us if we're making progress, if people are actually getting healthier and well in our region. So that's what we mean by anchor in shared measurement. And our public health partners are going to do a lot of work in this space. They have big plans. Our coalitions for health improvement really want to work in this space. I think we all have something to bring to this table. So then the last pillar, advancing transformation with a regional portfolio, is really about identifying collective goals, collective priorities that we can all get behind, and agreeing on a set of strategies, priorities, right? We can't do everything. So what should we prioritize as a region, and how can we take coordinated action? And then it's working together like at a local community level, at a county level, at a tribal level, at a regional level, to do some of this work and adjust as we go. So that's kind of how we're making sense of these pillars. And this is the latest snapshot. We might bring another iteration of it for you, but we keep trying to fine tune it based on your questions. So to John's point, don't hesitate to say like, this makes no sense, or this sounds jargony and wonky. I have no idea what you're talking about, because that's how it pushes us to be clear about what we're talking about and what we mean. So today, I just want to call out that last bullet on the left in the orange box. What does our network look like? And what does it tell us about how we need to work together? Because we have a really great team of network scientists with us today to help us make sense of networks. And it's actually a really cool area. And I hope that many of you are going to leave today thinking like, wow, I kind of want to be a network scientist. So next slide. I want to tell you a little story of why I got interested in network analysis as an ACH staff and in the work that we do. So one of our neighboring ACHs, I don't know if you all have heard of Better Health Together, but they're in the Spokane region. They did a network analysis years back, and the network scientists they work with happened to do an evaluation a couple years ago of ACHs in Washington State. And part of that evaluation was a network analysis. So that cool, really hard to see visual right now on the right-hand side actually came out of that evaluation. And you can tell by the visual that our networks are complex. There's a lot of us working, and we work in little clusters, but we connect. And so when you think about taking action together and making decisions together, like there's no one central organization that can control it all, right? Like we all have to do it together, but it has to be coordinated. And so when you understand your network better, you start to be able to be more strategic about how to do the work together. So I'm going to show you on the next slide a more concrete example with some of the organizations that you might recognize from our region. Because when I saw the original visual, I was like, well, this is really pretty and cool, but like, is it actually helpful? And so this one here, you can kind of see a local network, and each dot or circle is an organization in our region. And you can see that little cluster in the middle with Lake Chelan EMS. That's actually some work that the ACH helped fund. And it shows some of the connections they made with organizations that are not clinical providers, right? Like organizations in their community that work on social services and social supports, like Chelan Valley Hope and Tender Love and Care for Seniors. And they're also partnering with Columbia Valley Community Health. And so this is not a complete picture of the network. It's just one of the examples that we got, but you can start to see how how referrals are made, how relationships, what directions they go in. And so just wanted to share this slide with you so you could kind of see like a concrete example with some agencies that you might recognize. So this got me really interested. And another reason I've been thinking about networks, if you go to the next slide, Elizabeth, is that if you see on this map, you recognize our region, there's a bunch of little numbers. Essentially, those represent the clinics and sites that we worked with during the Medicaid transformation, and specifically Wendy worked with. It's the whole person care collaborative sites. So essentially, it's outpatient, primary care, and behavioral health partners across our region. And a couple of years ago, I started working on community-based care coordination. So I was in my head picturing like, I want to overlay the organizations that work on social services and see where they are and are they partnering with these healthcare providers. So Elizabeth, just click once. So I started thinking about the health home partners. This health home is a specific program, and these purple dots that just appeared are the organizations that help do those services on the ground. And then I was thinking also like, well, who else is out there that's kind of like people turn to for social needs? And so obviously I thought of community action councils. So Elizabeth, click. And I put like their headquarters, obviously they service areas outside of where their offices are, but they're kind of like matched up obviously with the population centers. And then I was thinking, well, there must be organizations in local communities that people also turn to, like kind of a one-stop shop or a place like if you're in crisis, you turn to X, Y, and Z. So go ahead and click, Elizabeth. And so here's some of the dots up by 22 and 28, that's room 1. The dot over by number 1 is Upper Valley Men's. We also have Chelan Valley Hope on there. And again, this is by no means complete. So if you are from an agency that represents a dot and you're like, I'm not on this map, that's perfect. We want you on this map. This is just to show you how like I was thinking about this stuff. And then last year, one more click, Elizabeth. Last year, we funded some programs and partners who were doing community-based care coordination. And some of them you'll see like the star over by number 33, that's the Cooley Dam area. We funded a new agency out there that could help with some supports, because when I was looking at the map, I realized there's areas where there doesn't seem to be anything. So either that means I don't know about it and it's not on the map, or like it means there's actually a big gap in that community. So that's kind of the way my brain was wanting to learn more about networks and what we could learn from them and how that might help our strategy. One more click, Elizabeth, because I wanted to share with partners on the call right now. On that right-hand side map, I just drew 3 little clusters that represent actual partnerships that are happening, and they're cross-sector partnerships. So clinics working with social service orgs, and even if you look at the little triangle cluster by number 1, that's Cascade Medical working with Upper Valley Men, working with Lake Wenatchee Fire and Rescue. If you look at the 2 little dots over by 33, that's in the Grand Coulee area. That's Cooley Medical Center working directly with rural resources. And then again, that cluster in the middle by numbers 37 and 16, that's the Lake Chelan EMS working with a bunch of other orgs. And so this is just, you start to see these little visuals of how people are working across sectors. And it just got me wondering and wanting to see this picture much more clearly. And that's how we kind of ended up in relationship with the Visible Network Labs folks who are here. And Kaylee, Amanda, and Danielle, can you wave? That'd be great. I'm going to do a little introduction of them. I feel so lucky to be able to work with them. We just started working really closely with Kaylee and Dr. Beacom, Amanda, a couple months ago. And Dr. Danielle Varda is here to help us learn about network science and why it's helpful, what we can learn from it. And Dr. Varda works at the, well, she's got many hats, actually. When I was looking her up, I realized like, hey, there's a lot. I'm just gonna have to pick a few here. So she's a network scientist, and she's also a network scientist that turned tech startup founder. So public affairs and public health students at the University of Colorado, Denver are super lucky because they get to learn from her because she's an associate professor there. And she also specializes in collaborative governance and network leadership. And she focuses on public health systems and services research, evaluates network structures and what we can learn from them to figure out what impact they have and what impact they could have. She's also the founder of Visible Network Labs, and that's the data science startup company that you will learn about today. They built a super cool tool that you're going to learn about today, and you're going to get to hear about how we can learn from those insights. And I hope that as you hear her presentation, your gears will really get running and you can think about how this kind of knowledge might help your work. So they have a great team. We'll dig more into their introductions later, especially for you, Dr. Varda, but I just wanted to at least get you to know who they are because we're going to go into breakouts before Dr. Varda's presentation. And I at least wanted you to know who you might end up with one of them, one-on-one, which is awesome. You'll be the lucky winner. So I will leave it there. I just wanted to frame like, why are we even talking about network science today? And this was just my example, my story of why I got interested. You probably have your own. And so I will leave it there for now, and you can go to the next slide. And I think, John, I'm passing it back to you.
Yeah, so just to get started for today and to get to know each other before we jump into the presentation, we're going to get together and just do a little bit of a pair and share, get to know you. So you're going to be breaking up into pairs, and so just share a little bit with each other about who you are and why are you here, what made you register for this session. You know, one of the things I'll just say that we've heard a lot, especially over the last 2 years, that people are craving and starving for is building relationships. And one of the things that we've actually heard is a detriment to the work is the lack of that. So this is just an opportunity to really to get to know each other and start sharing a little bit about each other. And then what is a network that has been especially meaningful to you and why? So since we're going to be talking about networks today, can you share a personal example of networks that have made an impact on you, whether it's work or personal, just something that really stood out to you would be really important. Welcome back, everyone. If it was like my group, we were mid-sentence when the time ran out. So you think 10 minutes is a lot of time until you get into 10 minutes and you really get to know each other. And so that is always the fun and joy of it. I think we had a little bit of time for reflections after this. And Caroline, were you going to walk us through that?
Yeah, or Wendy. I mean, really, this is an opportunity for anyone to unmute and share with the rest of the group any insights or comments that you talked about in your small breakouts that you thought others would benefit from. Any takers?
Any takers that want to share any kind of meaningful network that you've been a part of?
I would like to say that I met Kelsey and found a resource for Grant County in our area and able to get on a list to get some more information. So I'm excited about that.
Nice, already networking.
Great.
I was one of the lucky ones who got to be in a breakout with one of our presenters, and so I'm not going to spoil anything, and we'll just be quiet.
You're such a tease, Joey.
That was my thank you.
Well, I'll just mimic that because I got to meet Gerardo and Joseph, and it's really fun to be a presenter who gets to meet some of the people before you do that work. So I just want to say thanks for the opportunity to get to just talk with some folks. It's kind of weird to come in and be a presenter and not have enough context or know the group. So yeah, it was good to meet these guys. And really passionate about the work that you're doing in the communities. So really motivating.
I was wondering, just a suggestion, because of, the time restraint and we don't have a choice to meet every individual of the group, which would be amazing if that can happen. But you know how the time restraints are. So is there a way we can create a listserv or an Excel spreadsheet with everybody's organization title and a little summary of what what they do? This way, if we see something that we didn't get a chance to talk to somebody that we think will be a good fit, we can reach out to them via email or phone, it depends, and we can communicate this way. Maybe next meeting we can share that and continue to meet with each other, and that would help with the process a lot more. And it's on everybody's own timetable. So this is just, a question or a suggestion, however you want to take it.
No, that's great. And actually, it's funny you mentioned that, because right before, as we were prepping, before we let everybody in from the waiting room, John asked, should we just ask everybody to share their emails and orgs in the chat just so they have it? And we were like, well, I don't know, maybe we should just let it happen organically. Or so that's a great suggestion. And we can absolutely share the list of people who registered. Great, thank you, Brandy. You can do it in the chat. But if anybody doesn't want us to share their name, org, and email, maybe let us know. You can email us or chat us privately. But otherwise, if there's, if everyone's fine with it, we'll absolutely send out the list of emails and orgs along with the slides and the recording after the session. So thank you. Awesome suggestion.
And this is Cindy Button. Can you guys hear me?
Yeah.
Okay, thank you. Yeah, I'm doubling up here between the computer and the phone because I don't have a camera or a mic on my computer. And I just wanted to say, in particular to John, I think Zoom meetings are very efficient and they're safer because people don't have to travel and we can get together. But quite honestly, I'm very tired of them. And I really, truly miss the meetings before the meetings during the breaks, and the meetings after the meeting, and seeing all of your faces. And I'm really looking forward to some time when we can do that again. But meanwhile, I know it's an efficient use of time, but there's nothing better than actually seeing a person. And I think that affects the network a little bit, the involvement on how that works. Anyway, I just wanted to say that.
Thank you, Cindy, for sharing that. And that is actually a conversation that we're having internally of at what point are we going to move these, and maybe not all of them be in person, but do one in Chelan, Douglas County, one in Okanagan, one in Grant County, kind of move it around the region and interspersed with these virtual ones. So we're definitely thinking about that and making plans. So stay tuned, but appreciate your feedback on that. And if you do want to drop your name and email in the chat, go ahead and do so. Add your organization name too, so someone may not understand what the acronym of your organization is. It would just help explain to them. If you want to put your title or a little bit about your org, that's okay too. Do as much or as little as you want. But I think, Caroline, if no one has any more comments about any kind of network that they've been a part of, turn it back to you to introduce BNL.
That sounds good. Thank you. And actually, if I'm going to share something that Maggie mentioned in our breakout, which is that she's been building networks for decades. And I want to call that out because I think all of you are network builders. And you might be building different kinds of networks, like maybe you're building a transportation network or a housing network or a health care network. So we're all building different kinds of networks, but I think they all roll up and feed up into a bigger goal that we probably all share, which is that we want our communities to be healthy and well. And it's my pleasure to have Dr. Varda, Danielle, present to us. I've watched many of the webinars, and she's a great presenter because she can flex to your questions. So we're going to give her 25 minutes to kind of share some of her work and her insights, and then we'll have some time to have a little bit of dialogue. You can throw your questions at Danielle afterwards, or during the presentation, Dr. Varda, let us know what you prefer. And then we'll also go back into breakouts and kind of help you digest and reflect on the content before we come back and close out the session. But without further ado, I think I'll just let Dr. Varda get you all excited and turn you into data scientists, data nerds. So go ahead, Danielle.
Okay. Thank you, Caroline. That is such a buildup that I just feel like now I cannot disappoint. So I'm just going to do my best for this. But thank you for having us here today. I always say the favorite thing that I do is when we get to connect with people in the community and really try to support the impact that you're trying to make. We do it through a particular lens called network science. And one of the things I do love to do is talk to people about thinking like a network scientist, but I'll just give the big aha away right now is that you already are a network scientist. And hopefully I can convince you of that in a minute. But Kaylee and Amanda are here with me and really the people who do all the work that we get to do with you and your program. So I'm going to share my screen, but a couple of things that you will see about me is that I'm pretty conversational, kind of informal. Is this showing on the whole screen? Okay, there we go. So feel free to pause or put a question in the chat and anyone can kind of interrupt me, but I like to kind of tell stories. I like to make network science, like kind of demystify it a little bit while still talking about the science. And so that's what I hope to do today. And so I'll spend the first part of my time talking about network science and how we use it as a lens to think about communities and networks and communities. And then the second half, I'll pause for a question. And then I want to show you an example and kind of tell you the story of a network that has totally changed the way that I think about things and has led us to the work that we do here. So just to introduce us a little bit, we're called Visible Network Labs. Caroline mentioned I'm a professor at the University of Colorado, Denver, in the School of Public Affairs, but I've been building technology for about 20 years. I used to work at the Rand Corporation as a policy scientist, and I became a technologist, I think, when I was at Rand working with public health departments and the work they were trying to do to build networks around building partnerships and community collaboration to solve complex problems. And I'll talk a little bit about how that came to be, but it's been kind of a journey walking through these different kinds of networks that we are able to work with now. But eventually I started Visible Network Labs about 4 years ago so that we could build out on this stuff and do it in a little bit more of a flexible way. What we do is we really make invisible networks visible. I always say that all of us are embedded in some kind of social support network that's probably really deterministic of our outcomes, our health, mental health, wellness outcomes, but they're really invisible, not just to ourselves, with the people who are trying to help us. So we try to use networks and the measuring of them to help people see things they might not have seen before so that we can make really intentional decisions about how to leverage those relationships. Our team, we are a social enterprise, and our mission is just to really make sure everyone has the social support they need, whether they're working in an organization or at the individual level. We think about both. And we do all kinds of things. We're mostly a technology-based data science company, but we do lots of trainings and workshops. But really our hope is that we're just creating opportunity for collaborative innovation at communities and making that really accessible to people across all kinds of different demographics, purpose, and community. But this is fun. I always love to show this. This is just our team as a network map. But so we have, we build our stuff in-house, but we also have this amazing data science team that Kaylee and Amanda are part of that get to do a lot of this work firsthand. Okay, and last thing I just wanted to say is, because I'm going to talk about them, but we did build a data platform called Partner, and Partner does this. It maps networks, but we're not just network mapping. What we do is we measure networks. And so I would say the picture of the network is like the front cover of the story of your network. And we need to open that book and see what's behind it. And so that's where we get to really understand about things like the quality of relationships, what happens when we connect with each other, how do we attribute those relationships to outcomes, and all kinds of things like that. So that's what Partner lets us do, and I'll show you that in a second. And we also have a tool called Partner Me that allows us to do that at the individual level and understand personal networks. Most importantly, in the context with which we work a lot, is how people navigate resource referral networks or navigate systems of care and things like that. So I'll tell all of that through a story in a minute. But I think to help you kind of understand our background, the Robert Wood Johnson Foundation funded Partner for 7 years, and it's been used all over the country, and now we're actually working all over the world. And we have some networks, even in Ghana. Amanda and Kaylee run a project in 6 cities across the world, looking at social isolation and social prescribing. And where the networks, though, that have used Partner but also exist across the country are so different. That we have public health using this, health systems, but also education systems. We have people who are working on rural communities around suicide prevention. We work with the VA a lot, and also farm workers and things like that. But I just kind of wanted to show the breadth, not only of what we're doing with Partner, but the world of networks, the world that you're in today, is pretty common. It's a strategy that a lot of folks are using. And so our hope is that we can help bring data and some capacity building for making decisions about that. I always say, in networks, we construct them and we kind of think like, because we're humans, we should just be able to connect to each other really well. But I know personally, like almost nothing is harder in my life than managing relationships. So to have to bring that to work and do that together is kind of an assumption that we've made about people and their ability to do that. And I think we need some extra support. So I'm just going to switch over here to this, what I call thinking like a network scientist. Network science is really just the science of how things are connected. And, you know, from the physical sciences, people are interested in that. We are social scientists, so we're thinking about how organizations connect to each other and the outcome of that, and people connecting to those organizations and to each other. And like I mentioned, my real belief is that everyone, pretty much, if you're human, you are a network scientist, because we're doing it all the time. Like right now, you're trying to kind of figure me out and I'm trying to figure you out. And that's network science. It's us just trying to figure out our relationships. And not knowing how we perceive each other in those relationships is kind of challenging. I don't know what you think of me. So if I did, it'd be easier for me to kind of manage the whole presentation, for example. So when we measure relationships in network science, we're often capturing the perception of a relationship with someone else. And there really is, that's the true measure of a relationship, is the perceptions we have of each other. So your perception of me and my perception of you. There's also other things like we're all in a meeting together. So that's a relationship. But to be able to capture those perceptions and then use them to help our thinking about building and nurturing those relationships is so great to have. And it's adding a lens into this work that is typically pretty invisible. So one reason that I think I'm here and that you're here is that there's this kind of new way of working called the network way of working. And my slide used to say like a new paradigm. And it really is not a new paradigm. Everyone is working this way. It's almost a default that we don't even think through sometimes. We just assume that collaborating and working across sectors is somehow better. Legislators are legislating it. Funders are definitely funding it. But the problem is, we as workers and people who have jobs, we don't go to school for network science or relationship management. And so we're often, while our performance at work is now often kind of judged on how well we are working across boundaries, how well we're getting information from each other, we don't really have the opportunity to build skills or get information on that. So we're kind of having to wing it. And our hope is that we can shift that a little bit. I thought it would be nice to spend just a minute on the growth of networks, because I know this network is working on distributive leadership as a core concept. And it makes sense. This is kind of my slide on how networks have evolved. You'll see that paper that has a little picture down there called Neither Market Nor Hierarchy, Network Forms of Organization, was written by Walter Powell. And it was, you can see 1990, but that was the study of networks as organizational forms has been happening for years and years. And this woman that you're seeing, this is Elinor Ostrom, one of my favorite people. She was the first woman who won the Nobel Prize, first female to win the Nobel Prize in economics. Now last year we had our second. But Elinor Ostrom wrote long ago about collective action and how we have to be thoughtful about how we bring people together. Especially, she really highlighted the free rider problem. So what happens when you bring people together and you start to get one or a lot of individuals who are benefiting from the work together, but not contributing. So she contributed to that thinking. Luckily, we had collective impact kind of popped up now probably 10 years ago or so. The nice thing about collective impact, it gave a lot of funders and a lot of people something to call what we were doing. So it gave us these concepts. There's been a lot of work on collective impact since this time when they came out with these 5 must-dos. And I've written myself on some of the ways we might challenge some of these and say, is this right for all communities? But this was really great because it really moved us in a direction of understanding networks, but it was really designed to say, you should look like this and you should do these things, and this is the way it should work. Well, things have really shifted. And so networks today, we think a lot more about power dynamics, who gets data, who gets to be in charge of these networks. And so this concept that, these 5 things over here are what everyone should be doing, don't quite apply as much anymore, but more of a distributed leadership approach is really where networks are today. And what that means is really that we are working towards things like shared decision-making, governance, facilitation, and even data. You'll see in a moment how we at Visible Network Labs, we really embrace these concepts, especially around the democratization of data and how data should come back to the network and be a shared community asset. But that's a part of distributive leadership that I think you all are also hoping to embrace. But the truth is, this is the prettiest picture I could find of a graveyard, is that there are so many networks, and there is somewhere out there a graveyard where networks go to die. We are just overwhelmed. People in communities are being asked to participate in all kinds of networks, and we're really not giving people capacity or funding to actually engage in them. And so we're creating some pretty big inequities in communities where we're asking organizations that are really well resourced to participate in networks. And we're also asking organizations that are not well resourced to participate in networks. So we're taking away time from direct services. So I would argue it's really important that we don't waste our time in networks and that we really know what we're asking people to do. And when I say network, I mean these nodes and lines. You'll see, because we measure it this way, these nodes I reference are people, maybe organizations, they can be things, and then the relationships between them are those lines. And so what I'm going to show you is some concepts around how to use this framing of nodes and lines to be intentional and to think about those concepts. You'll see the method that we're using is called social network analysis, and I'm not really going to spend any time on it, just to reference that this is a methodology that is really meant to measure these kinds of things. And Caroline actually did a great job at showing some example of that earlier and how that looks. But I think so I promised to do this. I'm going to sound like a professor for just a minute, and then I'm going to switch off and not. But this, I think, is really important. Network science has this kind of unique lens, and there's this basic principle in network science that I find really guiding, and it's this idea that more is not always better. We tend to build networks as though and friendships and relationships as though more of them are better, stronger relationships are better, which could be true, but it's very difficult in communities to go off of that approach. So let me demonstrate that for a second. So all of us came here today, imagine you, with a set of relationships. We call these our strong ties, and these are usually ties to people who we pick. They're often a lot like us. We call them homogenous ties. The idea like birds of a feather flock together. It's how people form relationships. But what's happened is we have now started to form relationships across all kinds of these social subnetworks because of social media, just all the reasons why, we've changed our thinking about how we should do work, and it should be collaborative. The problem is that this can be pretty overwhelming. And there was a guy named Mark Granovetter who studied this for his dissertation work. And he had a hypothesis that said, he thinks people get jobs. How do people get jobs? He said through their social connections. So that's not that crazy interesting, but what he found, which was interesting, is that we don't tend to get jobs through these people that we know really well, because they tend to know the same things we know, but we tend to get jobs when we reach out across these different subsystems, because these people tend to know things we don't know, and they tend to have access to resources we don't have. And he called that the strength of weak ties. And so that's kind of what's fueled this like craze around networks, is this belief that if we can diversify information and learning, that we can build these great solutions. But the problem is that's pretty overwhelming, especially for organizations and communities. There was another guy, Ron Burt, who said, I love this idea, but what if we could reduce redundancies and be really strategic and intentional about our relationships? So we still connect to these subgroups, but if we can reduce all the work that we're doing to maintain all the connections, we can connect to new subgroups through new relationships. He called this building structural holes, and said we'll get more social capital, more collaborative advantage from fewer relationships. And so this is just a concept. If you go away with nothing else today, I hope this is one that you'll embrace, which is more doesn't have to be better. You can still be a great collaborator and a great networker if you can think a little bit strategically about this. And usually we have to start over here on the left to get over here on the right. And at VNL, we really believe that we can manage relationships, even manipulate them, hopefully for good, but that you need data to do it. And so our hope is that that's one reason why engaging in this kind of work is helpful for you all. So let me give just this example of, you'll see this slide says life cycle of a sustainable network. We've done a lot of research. We've worked with hundreds and hundreds of networks, and we're trying to understand what makes them sustainable. So an interesting thing about this slide, if you look in the middle, these circles and squares, let's say they represent organizations. They don't move. So in every picture around this, they are in the same spot. So what's different are the ties. So what this is just trying to show at first is that we can have the same group of partners, but their relationships can change very much, and it can affect our outcomes. So let me do this as like a life cycle. So in most communities, when a new initiative comes about, we get a group of partners that say, let's all get together and start a network. And usually they'll come together, and the first thing they'll do is make a list of like who's not at the table. And then they do network building almost by meeting two very early on. We've seen it so many times. That's what we do. We start to invite folks who aren't already connected. And that's what we're doing. And then we get to phase 3 and we build out this network. But the problem is we usually build it with the concept that more is better. So in phase 3, we get usually a backbone, some coordinating agency, everyone's invited to every meeting, and we think success is how many people showed up, right? And how much interaction we had. The problem is this is exhausting, and Eleanor Ostrom warned us many, many years ago that we're going to get a free rider problem. People aren't going to understand their role, and we're going to have people start checking out. So it's really, really hard to sustain a network that has a more is better strategy. So alternatively, what we've seen is that when networks can get to kind of a phase 4, which is, let's say this group, remember, same partners, now has 4 work groups, let's say 4 leaders who they really trust to disseminate information. Maybe one group meets weekly, one monthly, one quarterly, and maybe once a year we all get together. But at this point, everyone's been assigned a role, and they've been invited only when they have to play that role. So people who are experiencing phase 4, we find, are much more willing to stay on with the network when your funding goes away, when your leadership is getting drained, because in this phase, people tend to understand what they're being asked to contribute. And if it's with a strategy that we're not always trying to build more resources for this, but we're trying to get the same collaborative advantage with fewer resources, people can get around that. So we're really working on helping organizations and networks and communities get to a phase 4 thinking, just a frame of mind. This is not the right way you should look. But almost everyone that we work with is over here in phase 3 and eventually struggling. But so this is a model that we've been trying to really work with and test. And And this is the last one I promise before I break, and I'll ask for some questions. But I like to go from like really theoretical, here's what we're doing in communities, and then here's just like a real life personal network. So Caroline, you've probably seen this, but this is a personal network of mine, and it is about planning a wedding. And I like to show this one because I truly believe we're doing network science all the time. And it's a concept that you can use anywhere. So my story about this is I was planning my wedding about 14 years ago, and I was doing all the work for all the planning. And then I got to the point where I was like, where are we going to seat everyone at the reception? So I thought, let me put all of my people in my networks program, and I'll give everyone one connection to someone. My fiance and I were not in this because then they'd all be connected to us. But I coded them by these different colors, gave everyone at least one connection, and then mapped it. And that's the super fun part when you get a map. And what I saw here, I was super pleased because I thought, oh, look, there's some tables here, right? Like I can just figure out my 8 tops by grouping these people. Oh, and I forgot to mention, usually when we're doing this work, we're trying to decide, like, do we seat people who know each other together? Or like, do we seat people who don't know each other together? Because we'll build these great new relationships, right? So I saw this, my pragmatic side said, let's do this. But my network scientist side stepped back and said, whoa, look at what I'm seeing here. And what I see, this is all one, what we call big component, also called a closed network, which means everyone in here knows at least one other person. Over here, you see these like, this is open networks where they're not all connected. What I knew is that this was my husband's friends and family and their connections. And this was my family, like AmeriCorps friends, college friends, kayaking. I realized in this moment, we had very, very different kinds of networks that we were bringing to this relationship. And it really means something, you know, the way that we were kind of raised. He was raised in the Midwest where people stay really connected. A lot of high school sweethearts were getting married, where I was raised in El Paso, where I think we had a lot of thinking about going out and seeing what else was out there. And so it's been really interesting it was really interesting to see and think about our relationship in this way. What I ended up doing was just letting everyone sit where they wanted because I got overwhelmed with my overthinking of the whole thing. And I even have a little analysis of where people naturally sat when you let them do this at a wedding, which I won't go into here. But my point in bringing this forward is really just to say, like, you know, this is what we're doing all the time, and it's not really that far-fetched, even though it kind of seems like it when you look at the maps and all of that. So just to sum all of that up, building some takeaways. So hopefully these are what you'll can take back to work with you in your communities. Building and managing a network doesn't have to be left to chance. There really is a science and a set of tools to help you. I hope you believe you're already a network scientist and that you use it every day. So I would add it to your resume. Tell your boss, get some extra, bonus. You are a network scientist. You can manage network relationships to develop strategies, but I believe you need data or some insight to do it. More networking is not necessarily better, and you can identify redundancies and holes, which could be positive things for your network to strategize around. And finally, that this proven network strategy for sustainability is that everyone in the network have a role they understand. Participation is really only required when that role is needed, and otherwise it's optional. And that the network has a stated goal, that there is an end, that stated end is a part of your strategy. So most networks just are perpetual, but if you can make a goal, we're going to stop when we reach a certain amount of kids educated or vaccinated or whatever. It actually really helps the group to know where you're going, and they'll engage longer. So I'm going to end with just an example, a story of using this in real world, but I do like to pause here and just see if there's any questions I can answer before I kind of round that out. I'm going to look through okay. Okay, if there's not, that's okay. If anyone sees any in the chat that I'm missing, let me know.
I guess I have one question.
Yeah.
So I like the point where it went from, I think, like scenario 3 to 4, and you kind of went from like maybe the sense of redundancy to then more trimmed down, pared down, efficient networks. But then isn't there like a worry of then one person moves away or whatever, the network can kind of collapse because there's that one person who's then critical for connecting the different groups.
Yes, and actually I'll go to that. That is. And so this is why really there's not a model that I can share with you, which is the best model, but it's being intentional. I tell this story sometimes. When I came to the University of Colorado, I knew I needed to connect to a couple of different groups. For example, the School of Public Health. I have a secondary appointment there, but I needed to connect to them for research and advising. And they have a huge faculty, and I created the relationships that I needed, but then both of them left. Both people have been replaced. So it was really important for me to build the new relationship before they left with that new person. When we're talking about things like disaster and looking at networks of recovery, that bench has to be much more full than one tie. So there's different reasons your network might be vulnerable to one connection. So I think it's important to think about that question that you have. So I won't give you the answer, but if you're intentional about that, then you can prevent maybe some of that. At RAND, we worked on this defense project where intentionally, the military leaves communities and then comes back with different people. So they had a way to track relationships in these different Afghan communities where they would be able to pass it off to a new person. So institutional knowledge, that's why actually kind of mapping, what we do is we actually use partner ads, we call it a CPRM, a community partner relationship management system. So we store like a CRM, all this relationship in one place, try to make it available to the public, but use it so that the community can do exactly that work, Marlene, that you mentioned with data. I'm going to move forward again. Okay. Well, let me just finish this out. This is just a story real quick, and then any more questions would be great. But I really like to make sure that there's an opportunity to see what this means, like in a real life situation. So I'll just go through this real quick. I worked on a project called Wonder Babies with a colleague, Dr. Ayala Talmi at Children's Hospital here in Colorado. And she came to me and said, look, I've been convening these partners around building a better system of care for babies and young children with special health care and developmental needs. And we want to map it, like we want to see what's going on. And we think that visual will help us build a better system. So obviously the problem that we're trying to solve is that for families with kids, when you have a baby, it's overwhelming. Then you have a baby with a special need, and it's really overwhelming to navigate those systems. I think a lot of us on this call are trying to help people navigate systems through resource referral and building that out, care coordination. So this is kind of an example of that. So we did that work. I'm not going to show you like results. I'm just going to tell you this story. So this is the story of Colorado. We did that work. We did a couple of rounds of data collection, and we found this system that exists among providers. The center is kind of the Denver metro area, and then we got more of the rural areas captured on the outside. And when we saw this picture, people were like, yeah, that's us. We're excited. Systems people love to see maps of themselves. Systems, it kind of makes it real, right? So that was super helpful. And we did some really neat analysis. Like these blue nodes are the mental health agencies. People asked us, like, are mental health agencies really well connected, or where are they in the state? And because we knew this was kind of geographic, we can see them all over the state. And I don't have the slide on it, but if you took away the yellow nodes, the blue nodes aren't really that connected, which then we asked, is more better? Is it better that they're everywhere? Do they need to be coordinated? So great work for us to start conversations about strategies around mental health in these systems of care. Then we were able to look at, this is a real urban area of the state on the left. On the right was a rural community. And we were like, wow, in Weld County, they're not even all connected. So we got to start breaking this down and telling the story of the system of care by county and by rural versus urban community. So again, not really going into the results here, but something I wanted to bring up was that we do these member profiles. And this is something that you should get as being a part of this, is a profile of just your organization and where it kind of sits in the network, and then how it fits into the larger community, and then information from the surveys that we give. The reason this is really important, we started creating network member profiles so that people could have access to the results. So you ask people to answer surveys and they want to know, what happened to that information. So these are usually public facing, and it's a link that someone comes into and kind of interacts with this, but these are also PDFs. It's our way of saying thank you, but also network members need capacity building too. So we know a lot of folks use these like for their annual reports or to apply for grants. Every funder wants to know how you partner, right? So this has been a really important part of this. And so people in these systems were getting really excited about having this data. And that was great. And we even do these exercises with foam boards and thumbtacks, rubber bands, and we'd ask people, this is actually a group doing this work in Colorado, what is your ideal system of care? And it's never perfect, but we do this exercise with people pre-COVID, and we would use what they gave us as their ideal system, and then we would measure it, and that helps us build action steps to get from where they are to where they want to be. So we were doing that work, and then we went to families, and we said, hey, families, we've got all this great data. How can it help you navigate care? And the families doing the same exercise were like, we don't care about that system. It is a big ball of rubber bands to us. And all we care about is how to easily access it. And when we asked them to create their important ideal network, it was their friends and family and church and sometimes providers, but it wasn't these formal systems. So we started asking people, Ayala and I, to draw pictures of their social support systems on paper. And this is a mom with kids with special healthcare needs, twins. And you'll see in the square is her strong network. Those are all her informal ties. And then everyone else around it are all the people and places she needed to go to care for her kids. But we didn't even draw the connections because there's a real sense like they don't want to connect to those unless they have to. A social support system for a person is typically informal. People tell us they want to help themselves. They want to create systems of support for themselves before going into bigger systems. But as systems people, we tend to try to create the most perfect system for people to fit into. So we started doing a lot of research on this and looking, this is just like a view of, on the left, that Wonder Babies network, and on the right, the Families Network. And it was like, the left is a bunch of acronyms, right? And the right is like family and pediatrician and friends. And so just understanding that the perception of what an ideal system of care, when you ask people who are affected by it and you ask the people who are planning it, is really different. So we need to get around that in some way. And we learned there weren't really patterns of how people constructed their social support systems, except there are patterns that people always say they prefer their informal supports first, and that they want to help themselves and not necessarily be a burden. So people are kind of systems adverse while we're over here trying to build these great systems, right? So Ayala and I started asking questions like, why do we expect people to fit into perfect systems? And why aren't we building adaptive systems that wrap around those people? And we even said, you know what, our outcome measure is not like the best coordinated system, but when 100% of the people affected by that system say it's working, then we know that's actually the system that works. So I'll just show real quick what we did with that. I think network science is such an opportunity to give you a bunch of aha moments. So these are ours. So I'll just end here with a couple minutes. Partner Me is the tool that we, I used to end my talks always and say, you know, one day I'm going to build a tool that allows a provider to understand a person's support system or lack of it in just a few minutes so they can incorporate that into their care. So we got awarded $65,000 as part of the Innovator Society and built Partner Me, which has become quite a bigger thing these days. It's used in home visitation, schools, clinics, but the purpose of it is really to use this approach to ask people questions like in a screener. So maybe things like rating their own health or if they feel lonely, but then we'll ask people, you know, who's in their social support system, and with their finger or mouse, they'll show us maybe who knows each other, or we might ask who of these people could coordinate care for you if you need it. And what this gives us is insight into one of the most invisible things about people, which is whether they perceive themselves to be embedded in a coordinated network of care or not. And there's so much variance across people. And we ask them things like, to what degree do you trust this person to help you? And to what degree do you depend on that person to help you? Then we'll ask them, something like their social determinants of health. This changes for kids versus older adults and so forth. But we take the answer to these questions. In most cases, if someone said these 4 things, they would get 4 referrals. In our case, we pause and we just simply take the answer to those questions and we ask them something that we learned in research, which was that people want to help themselves. So we pause and we say, who helps you with the things that you need? And we let them show us that so we can find their most pressing need with the least amount of social support, because we rarely honor the fact that people bring assets to their own care, and we don't let people talk about that very much. So what this allows us to do is identify those people who are at risk of adverse social connectedness versus those who might have a really strong social support system, and then treat them, start to wrap the system around those data points. What that allows us to do is create profiles of these folks. And so one way we consider adverse social connectedness is someone who is, for example, socially isolated, but also someone who might have a lot of connections, but to people that they don't trust, but are highly dependent on. Like, say, a mom who's taking care of a bunch of kids, or a child with special needs, and then also her mother, right, at the same time. And so we see people who don't look lonely or isolated, but they don't have strong social support systems. And we measure those things, and we use those things to look at people over time and work with them on plans for creating stronger social connectedness. And we have an algorithm that shows level of social connectedness that we're trying to validate through some research and connection to outcomes. But also we connect people to resources. Our tool is agnostic to the resource database. People bring in their own resources typically. And just lastly here, how it connects back to that bigger system view. We are capturing these one-offs, for an individual, but for a system or a clinic or a whole community, we map it back out to that systems level to show what people need, who they're and where they're getting connected to those resources, and then use that at a real aggregate level. So we can look at things like, what are 18 to 24-year-old females needing? What are their, social support systems look like? And then how do we connect it to some kind of mental health or health wellness outcome? And last thing I will just show, I promise is my last slide. This is my daughter, actually, who really inspired me to start thinking about this approach for kids. Because she asked to use it, and it was very adult at the time. So what we have done for kids is really change the screener so that it asks them more about their kid needs, but we have versions for little kids, and then we have versions for adolescents. And the Annie Casey Foundation has funded us to continue to study social connectedness in adolescents so that we can continue to build out Partner Me for Kids. Kids love this. They lean in. You can watch people lean into this because it's very engaging. And there's just so much research that says that kids today, and I don't know if this is good or bad, but they trust technology sometimes more than adults, and kids will be really honest. So I feel like this is a really interesting new way to give new voice to kids, especially around their mental behavioral health needs and things they're struggling with, but also adults. So we have older adults who use this, all kinds of things. But the reason I like to bring up this story, and this is the end, is just to kind of show you where I had aha moments, because I took a network science approach, and I think you can have them too. So as you're doing your work, bringing a few of these little concepts in as you do that work, even starting with more is not necessarily better. It can really shift the way you're thinking about this stuff, and shift it sometimes so much that we can get to better outcomes. So my hope is that this brings a couple of aha moments that you can now adapt to your projects and your work in your communities. So open for any questions. I know I tend to just dump it all out at once, but I get really excited about this topic, and I really love the concepts.
Thank you, Danielle. That's awesome. And remind me, you have to pop off for another meeting. How much more time do you have with us?
I can stay for a bit.
Okay, awesome.
Yeah, I'm fine.
So any questions from anyone? What's going on through your mind, or what do you want more information about? Don't be afraid to unmute or use the chat.
I have a question. The Partner Me tool that you just showed, Is that done by survey? Could you in this similar way to the other tools that you have, or is it a different dynamic?
Yeah, it all lives on our partner platform, so it's just the same portal. But yeah, it is. When we use Partner Me, we refer to it as a screener or an assessment, because survey sounds a little different for patients, but it is. And so the way it works is that really a person can just get a link. So we have people who use it in person, like in clinic on an iPad, and we'll hand it to someone and they'll draw their things. And it's really nice because it's a really great way to be interactive. But we also have folks who are experimenting using it with, for example, at some mental health centers here in Colorado, we have very long wait lists. And so a touch point with a person can be like as a remote monitoring tool for before or after seeing them. They can just simply get a link. And we're HIPAA compliant, so we can put some PHI in there and then it links back. We're not connected. It's not connected to your EHRs yet. But most people, when they get that report at the end, they'll just save it and put it inside a person's medical record. So it's meant to be used in clinic or with a person, a client or a student, whoever.
Thanks.
Yeah.
And I know a lot of our healthcare partners are working on screenings, social determinants of health screenings. And if this is something you all want to learn more about, the Partner Me tool in particular, let us know at the ACH and we'd be happy to pull together a presentation just on that. And I think what resonates for me when I heard about the Partner Me tool, Danielle, is that it is very person-centered. And so we talk about person-centered care, but then we might not do screenings in a person-centered way. And so this kind of like gives you a potential solution for that.
Yeah. Well, and Caroline, just to connect it back to the ACH, the ACH at that systems mapping level, like the work that we're doing with you all, what we've found is that when we have people in community using Partner Me, I'm not just trying to sell you on Partner Me, but when we can bridge it back to the systems level, most strategies at the systems level say, let's coordinate, let's bring people, organizations together, and we will have better systems for people. But the truth is, then when you ask people, they're saying, I don't want to be a part of that. So if our network strategy is working, we should see people coming more and more into that network for resources, right? So in some of our projects where they're using both, we can really test that assumption. Are people, when we build better systems for them, are they accessing them with more confidence and trust and at more frequency? And the answer could be no. And if the answer is no, we should probably stop spending so much time building that system and ask, what could we do instead? So my point is just the more kind of levels of the system that you can capture, you can bring it all together and just ask the hard questions, like, are we actually making better results for that? So there's a real link, I think, between the work that many of you are doing for screening and the work you're doing with the ACH, which is super important work. You can't do one without the other.
And for those of you joining today as partners in our network, just to be super clear, we are working with Visible Network Labs we plan on doing a network analysis of our organizational network. So if you think of our 4-county region, we're a network of networks, right? There's sub networks within our large network. And I know some of you are here and you participate in your local coalitions for health improvement. That's a network. So what do all those networks look like? How are they connected? That's what we want to learn through the network analysis. And we want to, ask ourselves questions like, do we have everyone engaged that should be engaged? Or should we reach out and build relationships with folks who are doing great work, but are like in a little cluster over here that's not connected? Or do we have holes in our network, right? Are there areas that just really are under-resourced, and should we make investments there? So the network analysis can really start to kind of guide investments, guide strategies, and it's something that we really want to share with you all, like the information that we get. Again, we want to distribute the information so that it can help your work, it can help your networks. And at this point, we haven't really talked to the VNL team about Partner Me, because we're really thinking about the systems level work. But if that is something that you all say, we really need to figure out ways to use that tool at the individual level, then we can kind of figure that out and design that together. And we'd be happy to help with that as an ACH.
Caroline, if I can just add one thing, we will encourage Caroline and her team to make as much data as possible that comes from the SNA back available to you, like through those member profiles. Some of our projects actually make the platform a little bit more available. We believe strongly at VNL, and I mentioned it earlier, the democratization of data, but communities kind of deserve their data back, and often they don't get access to it. So we leave that up to each person who's kind of coordinating this, because there's also ways that some data obviously need to be private. And in network data, there's kind of a spectrum of where that falls. But if you participate in this, or when you do, we hope that you'll get something back for your organization that is a profile that allows you to kind of think about how you fit into that bigger system too. So that's something to look forward to, we hope. And after, I thank you for participating.
Any questions from anyone, or otherwise we can digest a little bit in smaller groups. John, I saw you unmute.
Yeah, Dr. Varda, one question I may have specifically, I'm curious, in the last example you gave, you did the network, kind of like the system network first, and then you went back and did the family network. Is there anything you learned, or how would you do that differently, or how would you combine the two so that on the front end, you are taking both into consideration?
I mean, that's such a good question. I think because I can tell you the day that we were with those families, and the one mom literally took our ball of rubber bands and stuck it on our board and was like, I don't care. And we were just like, oh no. But it was the thing that I think I learned in that moment was, you can have an assumption about what the right thing to measure is and the right outcome is, but and I'm like, oh, I'm a network expert, I should know this, right? But it doesn't matter. The community knows, and the people who are affected by it can tell you. And so I think for us, literally, I yell at in that moment, we were like, push everything aside, get a piece of paper out and your pen, and let's just talk about this in a totally different way. So being able to take what you learn and shift your thinking pretty quick, because that's the moment where we were like, oh my gosh, the system is not the outcome. It's individuals having success at navigating that system, which is the outcome and harder to measure. So that's something I learned, which has informed everything that I do running this company. Everything is like being able to kind of shift on a dime for that. But in terms of doing it together, I don't know, that's such a good question, and like what order we would do that in. I still think, I don't know, actually, John, I have to give that some thought. You've stumped me in how to answer that, just to be honest, in a design.
That's a challenge we run into, I feel like, all the time. Like, there's been a lot more discussion about bringing in individuals with lived experience. And I think that generally, mentally, people shift to SED and mental health predominantly, but obviously lived experience is any lived experience related to the work and services that we're providing. But it's still like, I would be right there with you. It's hard to understand how to do it in a really meaningful way, that you're not just checking the box. And what you did was very, I mean, there's a lot of truth to that, right? Like, we make assumptions for people instead of like understanding how the system works for people. And that's why I asked the question.
I will say one thing. There's a guy named Darren Hicks, Dr. Darren Hicks, and he taught me this. He measures authenticity of a process. So he has this great scale we can share with you too. But one of the questions, and we use it in some of our stuff, is to ask people who are part of a process, are decisions made in advance and simply confirmed by the process? And a lot, you can tell when they say yes, that you might have checked the box and brought them in, but they know that you already made a decision before they got there. And I think that has been one of the most telling ways when we talked about bringing in people with lived experiences or community members, is we don't want to bring them in and just for show. And also not just like to present their thinking, but to give them a space in decision-making and part of the discussion process. So we've had experiences where you can tell it's just considered inauthentic because people don't believe that their voice really matters, even though they're being asked to be there. So that made me think of that.
If there aren't any other questions, we were actually going to segue into small group breakouts again, to really take what we heard from Dr. Varda and some of the questions that were asked and start discussing some of these in small groups and then come back and report out. So you can see Elizabeth is sharing on the screen, and also when you put in the chat some of those key questions. So again, what are you hearing that excites you? As we strengthen our network, what do you hope to see and what will be success? And what will be the key for developing a strong network distributed leadership here in North Central Washington? So we're going to break out for 10 minutes to discuss these questions. And then when we come back, we'll ask individuals just to share one or two key things, maybe under each topic, that you felt really stood out that you want us to capture before we leave here today. Welcome back, everyone. We have just about 15 minutes left until noon, so we're going to take just a few minutes. Why don't we, if you either want to put in chat, or I actually strongly encourage you to unmute and speak if you're willing to do it too, maybe one or two key things you think you pulled out of that small group discussion that you just had. So you can either pop it in chat or feel free to unmute quickly.
One idea that someone in our group shared, which I thought was brilliant, is that a signal of success would be that we could rely on that service or that network to be there month after month, instead of having, here's an idea, we did this and then it went away.
One thing, I was in the same group. This is Oliver at the City of Wenatchee. I was in the same group as Ton. And one thing I heard was that services and the funding for services, those maps don't match the maps of the networks, whether they're personal networks or service networks. And so you run into visible and invisible walls that prevent people from achieving the outcomes they want.
An example being, we have struggled getting transportation from some of our transportation to Bridgeport because it's in Douglas County instead of Okanagan County. It's not that far away, it's across the bridge, but it's a different county and different rules.
Anyone else? Anything that really struck you in your conversation? Well, what I encourage you all to do, or what I encourage you all to do as you think of those questions or your discussions, as Caroline has shared, this is something we're going to be exploring, and we're going to be doing with Visual Networks Labs over the course of this year. And building a network is important. To build a network, it's important that we have input and engagement. So if you ever have comments or anything that really strikes you in these conversations, again, always feel free to share it with the NCACH team. And then I am going to turn it over to Caroline to give a little bit of our next steps.
Sounds good. And I plugged my email in the chat if anybody wants to follow up with questions or even suggestions. Some things that you can expect is that we're currently designing the survey instrument that we would like to use to understand our North Central network better. If you want to take a look at that survey and help with co-designing it and kind of, you know, making sure there's no holes in it and making sure we're focusing on the right thing, I totally invite you to reach out to me, and I will either spend some one-on-one time with you, or if there's enough people that are interested, I might pull together like a little Zoom work group just to look at that. There's a lot you can do with network analysis, and you have to kind of begin with like, what is it that I want to understand better? And then depending on that, it might influence the design of your survey and so on. So like, that's kind of the phase we're in right now. Timeline wise, we're really hoping to have a survey go out to folks in mid-April to mid-May. So that would be the time period for the survey data collection. And then I think we are shooting to have a report out probably in July. Kaylee, correct me if I'm wrong. Okay, July, back to any interested partner. So we'll make sure we bring it back to maybe Chai's want a presentation on what we learned, and we can actually interact with the data and show you the whole North Central map. But then if you wanted to focus in on Grant County, for example, we could just show you the Grant County results. Maybe we can come to, if there's a network of behavioral health providers that meets on a regular basis, we could come and share the data. And there is a way that you can filter, and Danielle showed you that earlier. You can show and light up the nodes of our behavioral health system. We could do the same thing with recovery coaches. So as long as we capture the characteristics of our network, and then the connections, will be able to kind of play around with the data. And I think that's what's so exciting, is we're not just going to get a static report PDF that you print out. We're going to get a tool that we can actually interact with and play with to inform our decisions. And so we get to kind of look at that together. And so again, reach out to me in the short term if you want to look at the survey and help with designing that survey. Otherwise, look out for more information when we release the survey. And there's something kind of interesting about the survey that I'll mention to you. It's not one where we just send out a link and anybody who wants will fill out their response. You actually have to designate one person per organization to fill out their survey responses on behalf of the organization. That is complicated, complex, and if any of you are like, well, why on earth do you have to do it that way? Don't worry, we've already had those conversations, because there's pros and cons to that. But obviously there's some reasons from a network science and analysis standpoint to do it that way. And so we've had a lot of conversations with Amanda and Kaylee about that. So I invite you to engage as much as you want. We'll make sure to invite you to look at the results and help us make sense of them, and for you to use them in your own work. Again, if you think back to that slide where we're talking about distributed leadership, we're also talking about distributed decision making and distributed action. And so our intent is really to help collect this information, but then share it back so that we can help everyone's work. Because in the big picture, we are all, even though we might work with specific sectors or specific types of work, if we roll all that up, I think we all really care about the health and well-being of people in the North Central region. So we all have a part to play. I think I will leave it at that. And I believe, Wendy, you were going to plug something into the chat. If you have any feedback for us about today's session, what went well, what could have gone better. We're really trying to make these convenings helpful and meaningful for you all. And sometimes we get it right and sometimes we don't, but the only way we can improve is if you tell us. So feel free to click on the link that Wendy dropped in the chat, and that should take you, you shouldn't need to log into anything, but just quickly give us some thoughts about what you liked today and what you would like to change in future sessions. That would be really great. And sorry for those of you who had any audio issues. Sometimes Zoom is not friendly with that, and we will look forward to coming back in person where any audio issues are only our fault. Let me see. Let me make sure I've covered everything. Oh, yeah, Mariah was going to share a link to our convening, or anybody can share a link to our convening for April. If you want to register for the April convening, we're going to focus on community engagement and what that means. So we encourage you to register. And I think, Wendy, I don't know if there's anything you wanted to say about some of the quality improvement sprint. Do you want to mention anything about that right now?
I have to find my unmute button. Mariah, I'm actually handing that over to Mariah, so let me let her speak about it.
Perfect.
Yes, I will put the link for that in the chat once I get that link. So the Quality Improvement Sprint is a 9-week series that is set to begin on April 14th. And we are looking for community-based organizations that would like to learn more about the model of improvement and how to apply that to something that they're working on within their organization. So again, we have that open for 15 teams, and that is open until we're looking until the 31st, hoping that we can kind of have everything solidified by April 1st with a start of April 14th. So let me get that link from, I think I just shared that link with someone on this call, actually.
And while Mariah plugs that in, I just, again, want to really thank Danielle, Amanda, and Kaylee for joining us today. They are in high demand, so we appreciate them taking 2 hours to join our group. And then also we have a lot of work to do in partnership with them ahead. And yeah, appreciate your time and insights. I'm super excited. Obviously, I'm a network geek. And I hope other folks today, like, your gears have gotten turning, and you think there's the hope, if we do this right, is that this is not just a cool, pretty picture. It's one that we actually get to use and learn from and actually apply. Applied science, my favorite. So thanks, everybody. Thank you for joining and hanging on until almost noon, and enjoy your lunch.
Thank you.
Bye, everyone.
Thank you.